My name is Peggy, and I am from Southeast Iowa, and I am seeing Dr. Aly and Dr. Cram for brachioplasty and a breast lift. Well, my mother used to joke that they put me on my first diet when I was a baby, like, 8 months old. So I was a big baby and fought it pretty much my entire life. In high school, to weigh 160 pounds, which seemed horrible for a high school girl, I coped with it by fasting 7 to 10 days and running 2 miles every day and skipping all my meals, and that kept me at 160 pounds. And then in early adulthood, when I stopped doing that, the weight found its way very quickly onto my body. And I, through a series of pregnancies, gained weight, and then did some yo-yo dieting, losing and gaining and losing and gaining, and every time it came back on again, it always brought some friends with it. So by the time I was, 45 years old, I weighed over 300 pounds. And it was very frustrating, and I'd kind of given up hope because I'd tried so many different things to lose weight. I was good at losing 10% of my body weight, and then it would stop, and I would get frustrated. I don't know if it's plateauing or what, but it just got very frustrating. And so a very good friend of mine tried gastric bypass surgery, and I watched with a lot of skepticism, and I'm very worried about her, but it was very successful for her. And a year and a half after her surgery, I had gastric bypass surgery myself in July of '05. So that was, I tell people, not the easiest thing I ever did, but the most successful thing I ever did, because it was such a massive weight loss, 145 pounds in a short period of time, and being 47 years of age, my skin doesn't remember where it belonged. And so I've joked with people that, because they'll tell me how great I look, and that's fine with clothes on, but I tell them with clothes off, I look like I'm about 80 years old. The skin isn't where it belongs anymore. It's sagging, and it's very loose, and there's a lot of extra skin everywhere. With the arms, it is a very limiting factor in terms of fashion, and I think this applies to men and women, but in the summertime, I'm not wearing short sleeves or tank tops. So that's really huge. It really limits, everything has to be 3/4 length sleeves, and when it's, 110 degrees outside with the humidity level in the Midwest here, that's kind of uncomfortable. And so that was primary, was, that it's very limiting in terms of fashions. I can't wear no-sleeve dresses. I can't, there's just a lot of things there. And I recommend to anybody that if you're doing this, you're not doing this for anybody but yourself. This really needs to be something you do because you feel the need to do it for whatever reason. I'm very comfortable in my own skin, so that's not necessarily an issue. This isn't something that alters my self-image, per se, or my opinion of myself, but it's just something I want to do because I've worked very hard to get the weight off, and I want to keep going and doing things for myself to make life better. I started poking around and learned that Dr. Aly and Dr. Cram are pretty well experts in body contouring. And so I started doing some research and learned that they were some of the top surgeons in this particular field. And I went to what I consider to be one of the best surgeons for my gastric bypass surgery, and felt that it was important to seek out the people that really know what they're doing in terms of handling body contouring after weight loss. And so after doing some research both on the internet and books that I'd read and different things, I settled on coming to Iowa City Plastic Surgery to see Dr. Aly. I was very impressed with his knowledge and with what he explained with me with regard to if I wanted to do an augmentation, which we probably won't, but why he wouldn't do a breast lift and an augmentation together because of some of the complications. And because of his experience and how many of these he's done, I feel very confident that he knows what he's doing. But then after that, I met with their office manager who explained the financial aspects of it to me, and gave me a quote, and then I talked to a nurse who went into some detail with me regarding aftercare and what to expect before the surgery, after the surgery, during the surgery, and then they sent me home with a great deal of information as well to read about potential risks and whatnot, things what to look for and how to take care of the incisions and whatnot after the surgery. So I'm feeling already, even though I haven't even had specific instructions on from a nurse, which will come later today probably, I'm feeling pretty confident about what's to come. So I'm prepared, I guess, mentally, which is what the staff here has done in a short period of time. So they really know what they're doing. You need at least, I think, one really solid person in your life that understands why you're doing this and supports you 100% for this, whether it's your spouse or your best friend or an adult child or somebody in your life that can be there for you before, during, and afterwards. It would take a really strong person to just plow through this all by themselves, which I think I could probably do, but it's much better if you have somebody in your hip pocket that's right there alongside. What I'm really excited about is the end result and having a good result, and again, you know, having my body kind of return to more normal, some sense of normalcy, so that I can wear regular fashions and be comfortable. Now, they're very specific in their disclosure that they gave me regarding scars. I understand that there'll be scars at any of the incision points, and they'll be visible, and the way that on the breast lift anyway, the way that they do that, it's not going to be on the top here, so it wouldn't interfere with fashions necessarily, but there'll be some scarring underneath and under the arm along this incision here. Preferable to having the bat wings that I now have, in my opinion. So I'm prepared for that and ready for it, and I'm trading one very problematic issue, I think, for a much less problematic issue, in my opinion. So it's the next step. It's the next logical step, is to get my body back where I want it to be. And like I said, for the majority of people, their skin just isn't going to remember where it belongs, and contouring is probably logical for them to at least consider and look into and research. So I encourage people to do that.